Hi guys, welcome back to Learn with MedNuggets. In this video, we will discuss a question regarding case control and cohort studies. If you haven't watched our previous video on what case control, prospective cohort and retrospective cohort studies are, please go and watch it before you watch this video. The link to that video is in the description box below. Alright, so let's start with our question. A group of researchers at a hospital plans to conduct a study to determine whether patients with a diagnosis of panic disorder or bipolar disorder are more likely to have a myocardial infarction. They plan to use hospital medical records to identify patients who were diagnosed with panic disorder or bipolar disorder between 2006 and 2008 and to select a second group of age and sex-matched patients without a diagnosis of panic disorder or bipolar disorder during the same period. The researchers then plan to examine medical records to determine whether the patients with a diagnosis of panic disorder or bipolar disorder were more likely to have had an acute myocardial infarction between 2020 and 2022. Which of the following best describes this study design? Alright, so in this scenario, myocardial infarction is the disease. Panic disorder and bipolar disorder are the risk factors we are studying. We are trying to find out if people with these two risk factors are likely to develop our disease of interest, which is myocardial infarction in this case. So now we are analyzing the past medical records to find patients with one of these risk factors, either panic disorder or bipolar disorder. In other words, we are going back in time retrospectively to find patients with the risk factor and without the risk factor. Alright? So we initially identify patients based on the exposure to risk factor status. After that, we are going through their recent medical records between 2020 and 2022 to find out if they developed the disease or not. So going into past means retrospective. We first found patients with and without the risk factor, with and without panic disorder or bipolar disorder. So this is a cohort study, right? If it were a prospective cohort study, you will be doing this in real time. You won't be going and analyzing the past medical records of these patients. Instead, you will follow up patients with the risk factor, panic disorder or bipolar disorder into the future to see if they'll develop the disease, to see if they develop the disease of interest, which is myocardial infarction in this case. If it were a case-controlled study, you will be dealing with a group of people who have the disease, who have myocardial infarction and don't have myocardial infarction. And then you'll go back in time to find out if they were exposed to one of these risk factors, which means in this case, if they had panic disorder or bipolar disorder or not. Thank you for listening. Have a great day.